Have a look inside yourself. Bipolar mood episodes and symptoms. Hello, enlightenment enthusiast. Welcome back to Have a Look Inside. Hit the road with us, flash your thumb with a like, and subscribe to ride along on our next adventure. Bipolar disorder. This video explains what bipolar disorder is, as well as different diagnoses and treatments. It offers information on how you can support someone with bipolar and tips for self-management. Manic and hypomanic episodes. Manic and hypomanic episodes, or mania and hypomania, both mean feeling high. Manic and hypomanic episodes have similarities in how they may make you feel or act. But there are some key differences. Severity of symptoms. Severe mania is very serious and often requires hospital treatment. Hypomania can noticeably change your mood or behavior, but it's less severe than mania. What's the impact on your life? Manic episodes can impact your ability to do your daily activities, often disrupting or completely stopping them. Hypomanic episodes can disrupt your life, but you may still feel able to work or socialize. Length of episode. For a mood episode to be classed as mania, it needs to last for a week or more. For hypomania, it needs to last for 4 days or more. But both manic and hypomanic episodes can last much longer than this. Types of symptoms. You may be more likely to experience severe symptoms with mania, such as more extreme risk-taking behaviors. Manic episodes can sometimes include psychotic symptoms, like hallucinations or delusions. Hypomanic episodes never include these. Both mania and hypomania can be really tough to experience and manage. Whether you experience mania or hypomania, or if you're not sure what you're experiencing, it's always okay to seek support. The hardest thing to explain is the racing thoughts when you're manic. It's like you've got 4 brains and they're all on overdrive. It can be scary but also euphoric at the same time. During a manic or hypomanic episode, you might feel happy, joyful, or a sense of well-being. Very excited or uncontrollably excited. Like you can't get your words out fast enough. Irritable or agitated. Increased sexual energy. Easily distracted, like your thoughts are racing or you can't concentrate. Confident or adventurous. Like you're untouchable or can't be harmed, more likely in mania. Like you can perform physical and mental tasks better than normal. Like you need less sleep than usual. Very focused or determined to complete certain tasks or projects. During a manic or hypomanic episode, you might be more active than usual. Talk a lot, speak very quickly, or not make sense to other people. Be very friendly to others. Say or do things that are inappropriate and out of character. Sleep very little or not at all. Act rudely or aggressively. Misuse drugs or alcohol. Spend money excessively or in a way that is unusual for you. Lose social inhibitions. Take risks with your safety. After a manic or hypomanic episode, you might feel very unhappy or ashamed about how you behaved. Have only a few clear memories of what happened during your episode, or none at all. Depressive episodes. Depressive episodes are periods of feeling low. They last at least 2 weeks, but can last much longer, sometimes for months. Like manic or hypomanic episodes, they can severely disrupt your everyday life. Severe depression may require medication or a stay in hospital. Some people find that depressive episodes can feel harder to deal with than manic or hypomanic episodes. The contrast between your high and low moods may make your depression seem even deeper. During a depressive episode, you might feel down, upset or tearful, tired or sluggish, uninterested in things you usually enjoy, low self-esteem and a lack of confidence, guilty, worthless or hopeless, agitated and tense, like you can't concentrate on anything. During a depressive episode, you might not do things you normally enjoy, have trouble sleeping or sleep too much, eat too little or too much, misuse drugs or alcohol, act withdrawn or avoid social situations, spend a lot of time thinking about upsetting or difficult things, also called rumination, avoid contacting or responding to people, be less physically active than usual. The lows can be flat and devoid of color, or intense and torturous. Sometimes it's full of demons, and pain inside so bad that nothing physical could hurt you. Mixed episodes. A mixed episode, sometimes called a mixed state, is when you feel both high and low. You may experience symptoms of depression, plus mania or hypomania at the same time. For example, you may feel very energized and impulsive, while feeling upset or tearful. Or you may feel very agitated or irritable. You may also experience highs and lows very quickly after the other, within the same day or hour. A mixed episode can be particularly difficult to cope with, as it can be harder to work out what you're feeling. It can be harder to identify what help you need. Your friends, family, or doctor might struggle to know how to best support you. The mixed episodes are the worst. The most unpredictable and most dangerous ones. I find them difficult to explain for some people. Psychotic symptoms. Not everyone with a diagnosis of bipolar disorder experiences psychosis, but some people do. It's more common during manic episodes, but can also happen during depressive episodes. These kinds of experiences can feel very real to you at the time, which may make it hard to understand other people's concerns about you. Psychotic symptoms can include delusions, such as paranoia, hallucinations, such as hearing voices. Then with mania comes the paranoia, the shadows, the voices, the thought someone is behind me following me everywhere I go, ready to get me. Stable or neutral periods. It's common to have stable or neutral periods in between episodes. This doesn't mean that you have no emotions during this time. It means that you're not currently experiencing mania, hypomania, or depression, or that you're managing your symptoms effectively. You might find you feel stable for years in between episodes. Or your periods of stability might be much shorter. Stable periods can feel like a relief, but they can also feel challenging in their own way. You may feel happy, calm, or relieved, worried about becoming unwell again, embarrassed or guilty about things you did or said when you were unwell, like you have lots to sort out or catch up on. Like you have to get back to normal life straight away. That you miss elements of your life or personality from when you were unwell. Unsure about whether to continue with medication or other treatment. It's a lot harder coming to terms with being stable than one could have imagined. Some people struggle with a new identity and way of life after spending so many years thinking the ups and downs of bipolar are normal. How often do bipolar episodes occur? Bipolar episodes happen at different times for different people. The frequency can depend on a lot of things, such as your exact bipolar disorder diagnosis, how well you're able to manage your symptoms, how you'd personally define an episode, whether certain situations or experiences can trigger episodes. For example, you might find that sleeping very little or going through a stressful life event could trigger a manic episode. The length of mood episodes can also vary. They can last for a few weeks or much longer. What's normal for you can also change over time. Well, that's all, folks. In the meantime, and as always, leave a comment or two and letting us know what you think. Until next time, happy living. Visit megdigital.com.